Many people ask me what they can do to make an artificial eye look better. And so the first thing is that many people have lost an eye due to trauma or due to a cancer or other type of a problem. And we've developed several techniques to make it almost imperceptible for some people that you can even tell that they have an artificial eye. And I'd like to go over at least a couple of the novel techniques that we've done to really help with that problem. With loss of the eye, there's actually shortening and scarring of the conjunctiva and the other tissues around the eye. And this is an opportunity sometimes for us to reconstruct that area, because without reconstruction it can often make wearing a prosthesis almost impossible or very, very painful or very unnatural looking. We've developed a technique, it's kind of a sandwich technique, where we can replace that tissue that lines the socket that's so problematic for many of these patients, and often do it in a rather large scale, so that instead of requiring 4 or 5 surgeries, that can often be reduced to 1, maybe 2 surgeries. And it takes special use of an anti-scarring agent called 5-fluorouracil that I've used for about 10 years now, and works very well to reduce the contracture and the scarring in this area, combined with a tissue glue. So it helps to reform and to glue these tissues together and to add these grafts without causing any scar tissue. And it really has revolutionized the way that I reconstruct these areas. This small slideshow and animation shows the defect, which is shown and labeled, and the muscle underneath of it. And normally when we place a graft in this area and tie it just with sutures, over time what happens is that there's a blood exudate that forms, and scar tissue really begins to contract and to cause this area to essentially break down and to require multiple grafts. The modified technique allows for the anti-scarring medicine to be placed with the syringe, and this scarring medicine then prevents much of the scar tissue from forming. Subsequently, at the same procedure, we then use tissue glue, which is almost like a peanut butter and jelly sandwich, where we combine the 2 parts to actually glue, biologically seal the mucous membrane graft or whatever graft that we're going to use to expand the socket. And instead of just a couple points of attachment that allow blood to get under it, it seals this area and really prevents any kind of blood accumulation from forming. This has, again, allowed these grafts not to contract and has dramatically changed their appearance for these patients. We'll show you a few examples of patients who previously were not able to wear a prosthesis, but now are able to wear a prosthesis and function quite normally. These patients overall have done very well, and if you have any questions, we'd be happy to help you to sort through and see whether this is appropriate for you in a very trying circumstance.